Competition prep. How can we help see these athletes in the clinic? What are we doing and not doing with these athletes? And where are we missing the mark in meeting these athletes out in the community? On today's episode of the PTNI's Daily Show, we're going to talk about competition prep, how to keep competitive athletes, whether they are at the elite level or recreational level, active in whatever they're doing, whether they're ready to run their first marathon, their first 5K, a CrossFit competition, whatever. How can we see these people, treat these people, and see more of these people in our clinic? So let's start with maybe the most important point. We have to be flexible with our appointments. We need to recognize that if these folks are not already on our caseload, they are likely only reaching out when a problem occurs, right? Everything is fine with their training until it's not fine and they encounter an injury. And sometimes that happens maybe the day before, the day of their competition. And they know they need our help. They do not want to drop out of that competition and they need to come in and see us. And so this is where having a more flexible schedule will really award the clinics that truly want to work with these people and specialize in treating these populations. That if you are working at a clinic where you're seeing a patient every 15 minutes, where you are overbooked at 125% or 150% of your availability, you're likely never going to see these athletes in your clinic. They need to get in, they need to get in quick, and they need to get in on relatively short notice. And so understanding that if you want to work with this population, you can't have a full schedule every day because that phone is going to ring, that text message is going to come through, and that person is going to say, oh boy, I dinged up my shoulder, my knee, my low back, whatever. I have a run, I have a competition on Saturday, Sunday, whatever. I need to get in. And so if you're somebody who prides yourself on having that 3-month or that 6-month wait list, you're likely not going to encounter this population very much or at all. So if you do want to work with these folks, you need to understand you need to have a couple of spots throughout the week available to see these folks on short demand. Now, once we see these folks in the clinic, what are we doing with them? I would like to break this down into 2 categories, things that we're going to do that might be classified as direct support and indirect support. So with direct support, what should these sessions look like? I think it's important to remember, and it's often missed, that when these folks come in, they don't need help with their programming, right? It is often last minute, as we discussed. And so thinking that we're going to change their programming, make tweaks, add eccentrics, add a loading protocol for a specific weakness. Remember, they're usually reaching the end of a very long training block. They're usually at their peak, maybe already through their taper and their deload. And so we need to respect that their volume is either currently very high or was recently very high. And so adding a bunch of stuff to their programming isn't likely going to be what gets them to the finish line on game day. They're already seeking your help because of maybe a high volume issue, a capacity issue, an acute to chronic workload issue. And so adding an extra hour of PT exercises per day is not going to cut it, right? Especially, do they actually have time for that? They're probably doing a lot of stuff with the nutrition. They're probably getting ready to encounter some travel that's going to be consuming some of their time. And then just remember, big picture, are we expecting anything that we prescribe to really have a meaningful long-term effect in maybe a couple of days, maybe 24 hours? The answer is no. We can't expect to improve strength, mobility, skill, whatever, meaningfully in 24 to 72 hours. And so providing that direct support like we like to provide should have happened, yes, earlier on in this person's training, but that ship has sailed, right? And we need to recognize that. We need to be okay that direct support from us in this time for these athletes is probably going to look mostly like what we might call body work, recovery work, soft tissue work. We're trying to calm this person down enough so that they can go and do that marathon. They can go and do that CrossFit competition. And if you're not comfortable with that, if you don't believe that that is worthy treatment, unfortunately, you don't have a lot to offer this population, because if they're coming to see you on a Friday afternoon and the first event is on a Saturday morning, nothing you give that person is likely going to bump the needle too much in 12 or 24 hours. And we need to understand that direct support in this time often looks like a lot of passive stuff, and we need to be okay with that. We also need to recognize that there's a lot we can do with indirect support to help these folks. Before we talk about indirect support, I want to stop and introduce myself. My name is Alan, Happy to be with you this morning on Fitness Athlete Friday, the best darn day of the week. I have the pleasure of teaching in our Fitness Athlete division here at ICE, where on Fridays we talk all things CrossFit, functional fitness, endurance athletes, runners, bikers, Iron men, Iron women, all that sort of stuff. If you want to learn from us in the Fitness Athlete division, our next Level 1 online course, that's an entry-level 8-week guided cohort, begins this Monday, October 14th. Our Level 2 online course, the sequel to the Level 1 course, if you will, begins again in January 26th. There's currently a class going through that course. And then a couple chances to catch us out on the road. You can catch Mitch Babcock up in Milwaukee, Wisconsin in about a month, November 9th and 10th. And then he'll also be down in St. Petersburg, Florida on December 7th and 8th to close out the year. So that's where you can learn from us on the road in the Fitness Athlete division. Indirect support. We really need to discuss this because in physical therapy over the past 10 to 15 years, we have really hammered PT first, no pills, no surgery, no imaging. And I think we've done a really good job with that, especially with active individuals. More and more over the years, active individuals recognize that they need a physical therapist in their corner. They maybe have a physical therapist that they trust, or they're looking for a physical therapist, or you're about to become their physical therapist after you help them successfully complete this competition. But we also need to recognize that by hammering, PT first, nothing but PT only, get PT. Do not see any healthcare providers. Don't go to the dentist. Don't go to your primary care. Just come to PT. We've kind of beat it into the brains of this specific population of patients that doing anything else is counterproductive. And I think that's a very dangerous place to be in with a population of folks who are just trying to get to the finish line of their competition. So respecting and understanding that these folks may have spent months or years training for this event, and that we need to be more open-minded. A lot like we need to be more open-minded with our manual therapy, we need to be more open-minded that maybe this isn't the time for a discussion on ibuprofen or injections or anything like that. That because the pendulum has swung so hard the other way that the only thing worthwhile in healthcare is physical therapy, these folks are coming in maybe a little bit worried that if they do anything else or they've done anything else, we won't help them. And certainly there is a subpopulation of physical therapists out there who refuse to help patients who are getting any sort of concurrent training, who've recently had any sort of maybe corticosteroid injection, or who are maybe taking ibuprofen or something like that. And we can be really nasty and vicious towards these people when they ask that question, especially when they're sitting in physical therapy with us of what else could I be doing, right? We have swung so hard that it makes us appear that we're 100% against all surgeries, no matter what. We're against any sort of injection, any sort of pill, any sort of anti-inflammatory anything. You just need to sit with that inflammation and let your body adjust and increase your capacity, which again, is not wrong, but that was the right approach 6 months ago with that athlete. It's not the right approach 12 hours before the competition with that athlete. And so this is a very crucial time period. Respect the work that these folks have put in and be open-minded and recognize that some short-term stuff is okay here, right? We're not advising that this person begin consuming 5,000 milligrams of ibuprofen every day for the rest of their life. I often think it's actually pretty funny when patients come in and tell me they take 200 milligrams of ibuprofen and it completely resolves their symptoms. It's hard not to laugh at that, right? Because that tells me that their irritability is relatively low because such a small dose of a relatively harmless chemical completely takes away their symptoms. And so don't be closed-minded to that. Be open to putting more things on board to help this person get where they want to go, which is getting through their competition successfully. And then we can talk about all the other stuff on the other side, right? We can have them come for a follow-up appointment after the competition, and we can talk about all the other stuff that maybe they're not open to hearing right now. Getting more sleep, managing training volume, having a look at their programming, all that sort of stuff. We have to get much more comfortable as a profession operating in the gray area of both fitness and rehab. We're not saying every patient should do surgery first, imaging first, pills, injections, etc. But we are saying that sometimes these things can be prognostic for us. And also we have to recognize that if they're only going to do these things for a couple of days, in the grand scheme of that person's life, it's not that big of a deal. So we've talked about how to get these patients having a flexible schedule, how to help them directly. It's probably mainly going to look like manual therapy and body work, how to help them indirectly, encouraging them that it is okay to maybe take a little bit of ibuprofen for 2 or 3 days if it helps them feel better. It is okay to go and do other modalities to get concurrent treatment. Whatever we can layer on to help that person get to that competition is all that matters for the next couple of days. Now, where do we find these people? Not surprisingly, we find these people in the fitness communities where they are competing, right? And so I have two really good examples of how PTs are just not in general out in the community, at least these communities, as much as we want to be, especially if we want to see more of these folks on our caseload. A couple weeks ago, I went down to the Masters Fitness Championship in Fort Wayne, Indiana. Very large competition, elite level, often a lot of CrossFit Games athletes there, only for folks 30 and up. So 30 all the way through whatever the oldest person there is. Very large competition, 20 athletes per heat, multiple age groups with an RX and then an elite, a CrossFit Games level division. All in all, about 500 higher level CrossFit athletes in one place, one giant coliseum. I went down there to support a couple athletes from our gym, and I was shocked to find that I was the only healthcare provider in the building all weekend, right? 500 higher level CrossFit athletes, one healthcare provider in the entire building. All weekend, as I was helping my athletes, people were walking back and forth, begging, can you please dry needle me? Can you please cut me? Can you please crack my neck, crack my back? All sorts of requests from folks who did not have a healthcare provider, a rehab provider in their corner. A giant miss, not only for that event itself, for any sort of physical therapy clinic in the Fort Wayne area to not be there and have a booth, some tables set up to provide support, but also a giant miss from the towns where these 500 athletes are from, right? That none of them are working with a physical therapist who could travel and take care of them. All athletes who are the scenario of the athlete in today's topic, all folks who needed some last minute help to make their way from event to event, to get some specific help, maybe with a movement that bugs them, and yet no one there to help them. Likewise, we ran the St. George Marathon last weekend. We went to the Expo Hall, 7,500 runners running the marathon or the half marathon, walking through the Expo Hall. Guess what? No rehab providers. One person doing something a little quirky with some foot analysis machines, and that was it. And I can't help but go to these events in public and look around and say, where are the physical therapists? Where are the rehab providers? Where are the folks who want to help anybody who may have a last minute issue get to that start line of that marathon? And same thing on the other side. In the cool down area, in the corral, where is all the post race recovery? There wasn't. There were two cold tubs, right? That was it. No rehab providers in sight to provide cupping or needling or stretching or literally anything. And so another big miss. And so if you want to attract more of these people to your clinic, not only do you need to have the availability to see them, but you need to be out and active in the communities where they are working out, where they are competing. You don't have to be a higher level CrossFit athlete. You don't have to be an elite marathon runner. I'm not, but you do need to be there, right? You need to have a table. You need to have a booth. These folks want our help. And unfortunately, we're off in our clinic waiting for the fax machine to ring with the next referral. And so we're missing the opportunity to capture what is a sizable population of patients who are not being helped in any meaningful way. So that's something to consider. So competition prep. How do we help athletes stay in the fight, get to the start line of their competition? We recognize we need to have flexibility in our appointments. We need to have openings to see these people and understand it's going to be relatively last minute asks. We need to be comfortable that our direct support during this time period looks pretty passive with a lot of manual therapy and body work. We need to be comfortable with indirect support, that these folks may seek out some concurrent treatments. And at least in the short term, we need to be okay with whatever they choose, knowing it is a short-term choice, and that if we can see them after, we can get them on the right track with a rehab program. And then finally, we just need to be around these people more. We need to be at these competitions. We need to be around these athletes and available to these athletes before the competitions so that they ask us to come to that competition and provide their support and keep them going throughout the weekend of their competition. So I hope this was helpful. I hope you all have a wonderful weekend, an awesome Friday. If you're going to be at a live course, have a great time. Looking forward to the dry needling course here at home in Fenton this weekend. Have a great Friday. Have a great weekend. Bye, everybody.